All right. So welcome everyone. Thank you so much for coming to this webinar. I wanted to start off with a couple of housekeeping things just to start off, and then we can get into the presentation. So firstly, if you're unfamiliar with LDA, we are a member-based nonprofit organization, and we are dedicated to creating opportunities for success for individuals with learning disabilities through support, advocacy, and education. And we have state affiliates across the US who can help connect individuals and families to local resources as well. So for more resources and information, you can always visit our website at ldaamerica.org. And I also wanted to mention really quickly that we have our 59th annual conference coming up in January, and you can find all that information on our website as well at ldaamerica.org. But we also have a special pre-conference this year on January 26th, and that is focused entirely on mental health. So if that's of interest, check out our website. And then just some housekeeping things really quick. If you have any questions for the presenters, there's going to be a section for Q&A at the end of the presentation. So you can put your questions in the Q&A section rather than the chat. That way it's easier for us to find them. They don't get us lost. And this webinar is also being recorded right now. So if you can't make it the whole time, it will be recorded, and a copy of the recording and the presentation will be sent out to all registrants. So thank you again, everybody, for being here, and I'll let our presenters take it away.
Great. Let me just share our slides here. Oops. And Lauren, is that showing you our full slide now?
Yes, looks good.
Looks good. All right, wonderful. So I am Lauren McGrath. I'm gonna take my mask off here. We've both decided to do that. Laura, explain a little more about that. I am an associate professor at the University of Denver, and my lab is called the Learn Lab, and we focus on learning and attention challenges in children. So I'm happy to be here.
And I'm Laura Santerre-Lemmon. I'm a clinical assistant professor in the Department of Psychology here at the University of Denver. And I also direct our developmental neuropsychology clinic, which is the clinical application of a lot of what we do. So we see kids, teens, and emerging adults for comprehensive evaluations that involve looking at learning differences, ADHD, other neurodevelopmental differences, and associated mental health challenges as well. So just a quick note, you noticed we took our masks off. We decided to do this talk in this way. Conditions are really good on our campus right now, and we have strong protocols. This is something that is permitted at this time. I will say it's both, exciting and also a little interesting for us to do this again. But we wanted to kind of be present with all of you together while we give this talk. So thanks for having us.
So as we kick off, we just want to share that we're so excited to be here with you, and that we really love giving these talks together because we're able to represent both the research and clinical aspects of this topic. So we here at the University of Denver have a really nice science to practice kind of virtuous cycle, we call it, where we're able to have a clinic that focuses on learning and attention challenges as well as a research lab. And I think it leads to some really important conversations. And I hope you'll see that theme throughout as we work through our talk content. So I just want to let you know about some funding that has funded the comorbidity work that we're going to be presenting on. So this is funding from NIH, particularly NICHD, that has allowed us to do this research, which is really important, and we're grateful for that.
And just to kind of start off, we really want to recognize that the LD community is really diverse with multiple intersecting identities. We want to recognize that the research literature has not generally reflected this diversity, and also recognize our own positionality in relation to this topic. One thing we've tried to do is reflect on the places of power and privilege that we hold in approaching this topic. At an individual level in our clinic, we're really intentional about considering client identities and contextual factors that contribute to an individual's clinical presentation that really help to inform our impressions and recommendations for that individual. Something that is also a little easier to do in a clinical context is to recognize and emphasize strengths and resilience. That can sometimes be more of a challenge in a research context. So we wanted to acknowledge that while we're going to talk about risk factors for mental health comorbidities, we want to recognize this is always balanced with strengths and resilience processes that are ongoing.
So it's so important. And one of the ways that we want to think about inclusion is around language conventions in this field. So in this talk, we're going to use the terms learning disability and LD, but we recognize that those are not terms that are preferred by some of the community. Learning differences is an alternative term that is preferred by some, but not others. And as the community is developing these language conventions, we were wanting to intentionally gather some data on inclusive language and hear from the community directly what language was preferred. So I am sharing with you a small study that I don't want to be overinterpreted. This is just a pilot study that we did with college students, about 85 college students who were registered for accommodations with their university, asking about what their preference was for language. And so what you'll see here are a series of options that we provided and how many people endorsed that was their favorite option. So the first thing to note is that learning disability was the most endorsed. However, note that it's not endorsed by the majority. And I think that's really important. And then the other thing that you should note is that there's just widely varying preferences within this community about language. And I sense that we're just in a time of evolving language. So we want to recognize that we'll be using the term learning disability and also that there's a lot of heterogeneity and preferences there moving forward. And I do hope to do some more work on this and expand this work going forward to a larger sample in the future.
All right, so kind of talking about what we're going to be talking about to you this afternoon or evening, depending on where you're at. We're going to primarily be focusing on school-age children with reading-related difficulties and many comorbidities or co-occurrences that go along with that. But that really is our primary area of research and clinical focus. So what we will be going through is what is comorbidity, what are common comorbidities in relation to learning disabilities, and also what are some evidence-based treatments for mental health and other comorbidities and some next steps moving forward.
And Lauren, I'm seeing some chats come through. I'll rely on you to interrupt us at any point that you feel like we might need to address a question in those slides. It's really hard for me to see the chat and the slides at the same time. So definitely interrupt if there's anything to address now.
Sure, sounds good.
All right, very good. Here we go.
All right. Yeah. So just to kind of orient to some basic facts about reading. This is a topic that I know some is going to be familiar to many of you. We like to just kind of talk through this whenever we're giving presentations because there is just sort of a variability in knowledge and unfortunately still some different myths and things that persist when it comes to reading and dyslexia. So we're going to be using dyslexia to refer to word level decoding and spelling difficulties. So word level reading and spelling. Other terms that you may hear are reading disability, specific learning disability and reading. These are really synonymous with dyslexia when we're talking about that word level decoding and spelling skills. So the prevalence of dyslexia is about 10 to 15%. So in a classroom of 30, that's going to be 3 to 5 children. So this is very common and something that is occurring really in every classroom. So we just want to make sure that we're kind of clear about that, how common this is, and one of the reasons why it's so important for us to be talking about and supporting. Another thing that comes up still repeatedly in parent meetings that we'll do and out in the community and things like that is this myth that dyslexia is a visual problem. So it is not. It is a language-based learning difference, not a visual difficulty. Visual interventions are not evidence-based. There's a lot of research on this and position papers and things like that that help to explain that piece. It still does persist. And so we often are hearing from families that they had been advised to do vision therapy or things like that. And so whenever we have the opportunity, we like to kind of put that out there that this is language-based and not a visual difficulty when we're talking about dyslexia. And so what the recommended evidence-based treatment is structured literacy broadly. And there are a number of different kinds of programs that do that. It's a systematic, multi-sensory based approach to teaching phonics and other reading related skills as well, that really having that systematic approach called structured literacy.
So that brings us to what is comorbidity? And I think one of the things that can be helpful is, so comorbidity is the co-occurrence of disorders. And I think many of us encounter comorbidity, particularly in medical spaces. So if you were to think about high blood pressure and the other linked health conditions that can come along with those medical conditions, I think we're more familiar with the notion of comorbidity in those spaces. But what's less commonly known is that comorbidity is also common in the psychology and learning spaces as well. So one of the statistics we have is about half of children with one psychological disorder also might meet criteria for another one. So this is a very common observation that we're talking about. And that brings us to the question, well, what are the common comorbidities linked to learning disabilities? So what I want to do is narrow in on dyslexia for now. We'll cover some of the other learning disabilities in a second, but narrow in on dyslexia and give you a sense of the scope of comorbidities that have been studied so far. So I'm going to represent this with Venn diagrams to try to illustrate the kinds of overlaps we're talking about. So one of the most common comorbidities of dyslexia is ADHD. So 25 to 40% of individuals with dyslexia will also be diagnosed with ADHD. But that's one that's known widely. We also have data on anxiety as a common comorbidity. And numbers there are ranging from 13 to 25% of individuals with dyslexia will also have anxiety. And then you might think about depression. And here the rates are elevated in girls, where we see 22% of girls with dyslexia being diagnosed with depression as well. And you'll also note that I tried to strategically overlap the blue and the green circles for anxiety and depression, because those two things are also highly comorbid with each other and with ADHD. So what we see is a larger kind of picture of a number of different comorbidities. What tends to happen, though, is we have noticed, at least in our time in this field, that specialties related to dyslexia and our other comorbidities on the right tend to separate a bit. So it's difficult to get expertise that blends both the learning and the mental health aspects of these complex clinical pictures. So we want to note that it can feel hard to find individuals with both sets of expertise. And one of our goals in this talk actually is to encourage practitioners who are working on the learning side to think about the mental health side, and then practitioners that are working on the mental health side to consider those learning factors that are also contributing, because we really do have kind of an overlapping picture that looks like this for many, many children. Of course, not all children with dyslexia will have comorbidity. There are children that will have dyslexia alone, but the rates of comorbidity are so high that we really need to pay attention to this phenomenon. Okay, so as we think about, I want to broaden now to some of the other language and learning disabilities that might also be part of this clinical picture. So we know that language disorder and dysgraphia are also part of our picture, as well as dyscalculia. And dysgraphia, also known as writing disability, dyscalculia, also known as math disability. And so if we think about these as also part of the comorbidity picture, it can really get quite complex of overlapping Venn diagrams here. This can feel very overwhelming, but I want to give us a way forward to think about how these might cluster in ways that would be meaningful and point to treatment outcomes. So if you were to, in this clinical picture, let's just focus on the language-based learning disabilities and assume that math is not part of the clinical picture for an individual child in this case. What I want to point out is that there might be overlaps like dyslexia, language disorder, and dysgraphia kind of having some shared factors, and then our mental health pieces having some shared factors. And this leads us to some strategies that you might look at, learning strategies that are going to work with language and help with reading and writing. And then you might think about behavioral treatments, perhaps in the psychology realm, that would simultaneously address anxiety, depression, and ADHD as well. So while the clinical picture can be complex, usually you can distill down to some clusters that are treatment targets to help with this complexity.
And just to kind of emphasize some of this a bit more, it's important to understand that these co-occurrences are expected and what those rates are, that there's a lot of overlap, like was noted in sort of medical community as well. So that can help families to have more of a holistic sense kind of what is going on, where things might cluster and how we address that. For both the challenges and then also strengths. And that, again, is such an important piece of this, particularly when we're working with families clinically. So it's really common for a psychoeducational or neuropsychological evaluation to uncover kind of several areas where there might be challenges that again can sort of cluster in particular ways when we're thinking toward treatment, and also to find where strengths are at. Which is always an important piece and something that we're talking about with families and in guiding recommendations and sort of how we're supporting the kids and families that we see. And these are spanning both the learning and mental health aspects of things. So, and again, just kind of noting that this is expected, right? So, so perhaps not so specific, right, when we're talking about learning, but thinking of these clusters of things that we can help to address.
Okay, so I want to talk specifically now about ADHD and then anxiety and depression, and the different ways that those comorbidities come to be, because it helps us with knowing, developing a treatment strategy, essentially. So if we take dyslexia and ADHD first, the take-home message is going to be that we really need to treat both of those challenges simultaneously. And the reason for that is that in our research, what we have done, and this is research that exists in the field, what we have done is look at how dyslexia and ADHD influence each other over time. So what we'll do is we'll collect a sample at time 1 of children with dyslexia, children with ADHD, and look at time 2. And what we see is that reading difficulties tend to lead to reading difficulties later on, and ADHD also. Now, that's not ruling out that excellent treatment can help improve those long-term relationships. But what I want to mostly point out here is that we don't see that dyslexia, for instance, causes ADHD down the line, or ADHD causes dyslexia down the line. There's a little subtlety in there that sometimes they can magnify each other a little bit over time. So I don't want to state that too strongly, but the lion's share of what's going on is that children have this comorbidity, and that both things need to be treated. It is not the case that one is leading to the other. Now, the picture is a little different when we think about anxiety. In that case, what we do see is that dyslexia early on at that time 1 point can lead to later anxiety difficulties in some children. Again, not all children with dyslexia will have anxiety, but there is a higher rate. And what we see there is that by time 2, we will need to treat dyslexia and anxiety, that will need treatments for both of those. And that's really important once both are present to treat them separately. But for some children, it might be possible to diminish the manifestation of anxiety over time with early reading instruction. Again, that's for some kids and not all. Would you mind just scrolling down a little bit? Thank you. So, and I also want to point out, it is common in these spaces for learning and anxiety difficulties to go unnoticed. And what's important is that once we come to an understanding, we have excellent treatments for both of these conditions. And so it's really important to keep a forward-looking perspective about what can be done at that current time. So is there anything else that I missed here that you wanted to highlight there?
No, I don't think so.
We got it?
Yeah.
Okay. All right.
So then getting into what are the evidence-based treatments for mental health and other comorbidities with learning. So we're going to start with ADHD. So something that I like talking about and like talking with families about is first having an understanding of what ADHD is. And I think some of what can contribute to stress at times is sort of feeling like, you know, people maybe don't understand, right, what is going on for an individual that may experience these kinds of challenges. So one of the things that we talk about is that the name itself presents some problems. So its attention deficit is the first part of that. And it really is not an attention deficit. It has much more to do with regulating attention for different contexts. So we'll sometimes say we'd like it to, you know, the attention dysregulation instead if we need to keep that first part of the acronym. So when we think about it in terms of dysregulation, this can help when we hear the sort of very, you know, common sort of statement from families at times of, okay, well, how can it be ADHD if my child can play video games for hours, or, you know, fill in the blank, whatever that sort of something that really grabs their attention and interest they might be able to engage in for a long period of time. And then why is homework or chores or those kinds of things, why are those things so difficult, right? So if we think about it again in terms of regulation, this helps to explain what we see, which can at times certainly be a strength, being able to sort of, you know, when something really piques interest, being able to take a deep dive into those things. But that also can signal some challenges with regulation. So difficulty kind of down regulating from the thing that someone really wants to be doing and enjoys doing to get homework done or chores done or those other things that need to happen. So we really like to talk about and kind of emphasize thinking about it in terms of regulation as opposed to a deficit. People with ADHD can absolutely pay attention to things. It just might look a little different, kind of regulating in the moment, depending on the particular demands, interests, those kinds of things for different contexts. So that's just an important piece to kind of think about and note before we get into what helps. So when we think about what we're trying to support with ADHD, we are trying to support, again, attention regulation. This sometimes spans a little out from just regulation of attention to more general kind of self-regulation, or what we may think of as behavioral or emotional regulation as well. So again, that regulation term becomes useful, but that's what we're wanting to support and to develop skills for addressing that and other tools, and also for executive function skills, which are very commonly associated with attention and learning. So some evidence-based approaches to consider. One is medication consultation. So we know that, you know, families have different kind of views and values around this, but we do want you to note that there is a research basis for its efficacy. That being said, we're also not psychiatrists, and so we direct you to your pediatrician or psychiatrist for further discussion of those kinds of questions. But from a research perspective, it has been shown to be one of the tools that can help to support attention regulation for people with ADHD. Executive function supports are also things, we're going to get into this in a little more depth coming up here. When I'm mentioning this, we're not talking about cognitive training. Like working memory training or things like that. They don't tend to transfer very well to sort of real life, you know, situations and things that people are dealing with. What we're talking about are practical skills to manage schedules, routines, and priorities. Then we're going to talk a bit more also about kind of behavioral treatment and caregiver supports as well.
So in terms of the co-occurrence of dyslexia and ADHD, I want to go through a research study with you that is one of the bedrock studies in our field, helping us know how best to treat children with both dyslexia and ADHD. So this is a randomized controlled trial done by Tam and her colleagues. It had about 200 children. They were in grades 2 to 5, and all of the children were diagnosed with dyslexia and ADHD. And what they did in their design is they had 3 arms of treatment that children were randomly assigned to. So the first treatment arm is an ADHD treatment alone. So that involved carefully managed medication and caregiver training. And we're going to talk some more about what's in kind of caregiver training in a second, but know that that was a behavioral intervention. So both medication and a behavioral intervention here. They had a dyslexia treatment alone, which involved intensive reading instruction, evidence-based reading instruction. And then they had an arm that was about a combined ADHD and dyslexia treatment. So this involved a combination of the first 2. It had medication, it had a behavioral caregiver training, and it had evidence-based reading instruction. So all of the 3 pieces all together. And so their question was, what is the right approach of these arms? Which one is the most effective? So the high level summary for this study was that inattention and hyperactivity symptoms were significantly improved if you were in the ADHD treatment alone compared to the dyslexia treatment alone, or if you were in the combined treatment versus the dyslexia treatment. And note that the combined and ADHD actually didn't differ from each other. So the take home there is that ADHD treatment is specific to ADHD symptoms. So if you received some sort of ADHD treatment, either as part of the arm alone or as part of the combined treatment, that was better for the ADHD outcomes. And basically the mirror image happened for reading outcomes in the children. So reading outcomes were significantly better if you were in the dyslexia treatment alone compared to ADHD treatment alone, or if you were in the combined treatment, which remember has reading and ADHD versus just ADHD. So again, you can make the mirror conclusion that dyslexia treatment is specific to reading symptoms. And this is really important because remember, every child in this study had both dyslexia and ADHD. So ideally, you would want both sets of symptoms to improve. And the only treatment in which both sets of symptoms improved was in the combined case where you got treatment for both things simultaneously. So the high level summary is that combined treatment works to treat both domains. And in fact, you do need both treatments to impact both domains. And that children with dyslexia and ADHD benefit from specific treatment in each domain. And we really wanted to highlight this study as an organizing principle for our field, because in our interactions in the community, we often hear some variation of, we're going to treat the reading and wait to see if the ADHD improves, or the other way, we're going to treat the ADHD and wait to see if the reading improves. And this study is just very, very clear in its findings that we really need to treat both simultaneously in order to get that improvement in both sets of symptoms. So that's just a really important finding, and I hope that is clear. And I think it's a really guiding study for our field. Okay, so you might be at the point of saying, okay, but how would I know if I was getting evidence-based treatment for ADHD? And I want to introduce you to this resource if you aren't familiar with it already. It's a fantastic resource for all of child mental health. It's called effectivechildtherapy.org. It's put together by Division 53 of the American Psychological Association, which is the child division. And they do a wonderful job keeping it up to date and keeping good resources for families and practitioners up there. So this is a resource for any mental health difficulty, but it particularly is a useful one for ADHD as well. And so in terms of ADHD treatment, what we're going to talk about is what you're looking for if you were seeking behavioral treatment for ADHD. And what you're looking for in this space is work with the caregiver to set up structures that are going to help school-age children move through different routines. One that we hear really commonly is that the morning routine and the bedtime routine are really, really difficult to move through. They often involve going from preferred things to less preferred things, which makes it just a really difficult hump to get over. So one of the ways that behavioral treatment, one of the questions behavioral therapists might ask is, what are those structures and how are they working for moving through the morning and bedtime routines? And those can be pretty disruptive for families. So that's often a first treatment target. The other place that behavioral treatment is focusing is on caregivers developing skills in deploying attention to the children's successes. And this is so critical for children with ADHD because they frequently get a lot of negative and corrective feedback throughout their days about things not to do and things that they should be doing differently. So this orientation around positive attention when kids are on task and doing what they need to be doing, it can be so powerful and really just change the whole caregiving environment. So deploying attention and not forgetting about positive attention, particularly from caregivers, as a really important lever that you have in your behavioral strategies. So the other parts of this treatment, often there's a big focus, not just on deploying positive attention, but also tangible positive reinforcement systems. So caregivers develop skills in using those kinds of positive reinforcements. And I should say it can sometimes be tangible rewards, but families also have success with, for instance, children working towards more independence in something they are looking to be more independent with. So it doesn't just have to be kind of the more classic reward system, but other ways to build in positive reinforcement for success and challenging oneself and meeting goals. And then an important point, and you'll notice those 3 bullets are all about a lot of intensive work with caregivers actually in setting up the home environment to support skill development. The children are involved in setting goals, developing the reinforcement system, getting buy-in, making sure that the things that the caregivers are working towards are shared goals. That's really important. But a lot of the work is actually happening with caregivers, and that can sometimes surprise families who think that there's mostly going to be one-on-one with the children. There is some one-on-one time with children, but there should be a lot of one-on-one time with the caregivers as well, developing these kind of positive strategies. And then the one thing, if I were to leave you with one place where families can get really far down behavioral treatment routes and have good success, and then sometimes it falls back, is that the reinforcement system that you initially develop with children with ADHD loses its novelty very quickly. So whatever the reinforcement system is, expect it to have to change perhaps on a weekly or monthly basis to make sure that everything is staying fresh and new and goals are sort of front of mind for students that they're working for. So that novelty piece, it wears off really quickly for kids with ADHD, and there are some ways to keep it interesting. We do things like spinners, and we have a vault where rewards will go in there and then they only come out at certain times of year, ways to kind of build novelty and keep motivation high for this. And I'll just note that I was talking about this in relation to caregivers, but the same strategies can be adapted for the school setting as well. The fundamental principles don't change here in terms of how to support success for that.
All right, so we really want to note that there are a lot of good resources. We've selected a few that we found helpful. There are certainly others out there. And so we've kind of divided this for caregivers and individuals with LD and educators and practitioners, but certainly plenty of overlap in these resources as well. So here are a few that we like. There's a really nice kind of fact sheet about myths about ADHD, there certainly are many of those, especially related to the deficit versus regulation piece that we were talking about before. And oftentimes, it might happen where a child that is having difficulty with attention and executive skills gets labeled as lazy, unmotivated, those kinds of things, right? When that's really not what's going on, we need to help with building new skills, right? For these individuals to be able to show their strengths, right? So that's really what we want to do. And that's a nice kind of handout there. The CHAD website, Children and Adults with ADD, ADHD is another good resource. And then the Child Mind Institute has some nice kind of pages on there. Some also about ADHD in girls and women and ADHD more generally. And so some nice resources from Child Mind also. For educators and practitioners, here's just a sampling of some branded treatments. So these are a few that we've noted here. They don't have to be these branded offerings, but these are ones that are out there. And then some also for executive supports, again, don't have to be branded offerings, but here are some that we'll mention here as well. All right, so getting now into anxiety, we're going to talk about some of what this looks like, and then what some recommendations would be for that as well. So
I'm not sure, you might not know what time it is. So
oh, yeah,
sorry,
thank you. Yeah, so many things.
We have a lot of screens. But
Yes, we do. No time on them. Thank you. Yeah. So as far as manifestations of anxiety that we tend to see sometimes secondary to learning differences, you may end up seeing avoidance of school and school tasks. Physical complaints, this is something that shows up in the research: stomach aches, headaches, increased nurse visits during the school day, all kind of related to avoidance, right? This is, of course, ruling out medical explanations. Sometimes you may find that those stomach aches and headaches and nurse visits are happening during school and not at other times. During certain classes, during times when they might be being asked to do a certain thing in the classroom, like a read aloud or that kind of thing. And so just kind of attending to some of those potential, physical cues that might be indicating anxiety secondary to learning differences is important. And we'll talk about this a little more in a bit, but anxiety loves avoidance. So avoiding certain tasks that provoke anxiety is a place that you may see that as well. There also can be concerns for social evaluation from peers and teachers, right? So some of those kind of social anxiety related symptoms, which can start with reading and feeling maybe anxious about reading with peers for the teacher, those kinds of things. And it can sometimes grow to impact other domains of functioning as well, related to social and other anxiety. Math anxiety is something that has been well studied. So you probably heard that that term before, math anxiety. Not so much with reading anxiety. There's a kind of an exception noted here with a link, but this is something that I don't know if you want to speak more about that, but that we're kind of working on looking at more as well.
Yeah, that's something our research lab is really interested in moving into. And one of our first challenges was to find a reading anxiety measure. There's many for math anxiety in school-age children, but very few for reading anxiety. So I'm giving one link for a group that has developed a measure of that. So I just note the discrepancy. We've thought a lot about math anxiety and not so much reading anxiety in this space.
Yeah, so what works when we're talking about anxiety? So how would you know that you're receiving evidence-based treatment? As I mentioned a little bit ago, avoidance is a very central mechanism, and that's what treatment should be addressing. So we like to say to families, when we're talking about anxiety and recommending kind of skills-based treatment, anxiety is going to be saying, no, don't do this. This is not something that you want to be engaging in. And, some of that even through as you're getting into treatment, right? It's important to know that's a really typical feeling, to feel like, not interested in this. That actually is a cue that you are likely working on skills that are helping to kind of dislodge anxiety, right? And sort of helping work toward building skills to manage it. So yeah, avoidance, like to say, is anxiety's best friend. So you want to learn how to do the things that anxiety is telling you not to do. So, many of the effective treatments have a cognitive behavioral therapy or CBT tradition. This really is meaning that they are skills based. So you are learning skills, practicing them in between sessions, and really this begins with kind of figuring out what fears and worry thoughts are and gradually approaching new challenges and building confidence and skills along the way. Certainly things like, coping and relaxation skills are helpful, but those should not be the only components of treatment. We really want to be working actively toward addressing fears and worry thoughts with other skills as well. We'll talk a little bit about this, but certainly, depression co-occurs, and there are treatments that will discuss that are addressing both kind of symptom domains as well. We call sort of transdiagnostic type approaches that are building skills for both. All right. And so as far as some resources about anxiety and other mental health for caregivers and individuals, we've noted a few resources here. So the Association for Behavioral and Cognitive Therapies, kind of across the board, has some great resources, as does the Anxiety and Depression Association of America. There are several just wonderful kind of fact sheets, Kids Health here. So this is one that we noted links to a few for parents, for kids, and for teens. And then the UCLA Cares Center has some really nice resources as well. For people at schools, there are some great fact sheets, and then an Anxiety in the Classroom, sort of more recent resource that is really helpful for educators and school providers about how to identify and support anxiety in the classroom. All right. So we've been mentioning approaches for ADHD and anxiety, which are two of the most common comorbidities. However, as I was starting to mention, we started with that sort of overlapping Venn diagram. You should expect that there will likely be co-occurrence for some, not all, but for some children of other mental health difficulties as well. So kind of going back to the earlier Venn diagram, anxiety and depression are highly comorbid and both benefit from skills-based approaches. So kind of like we talked about these sort of clusters with learning, like language related learning differences, the same mental health provider using these skills-based approaches can be addressing symptoms of anxiety simultaneously or sequentially as needed. So it's, again, sort of things that might cluster together that we can certainly address in that way.
All right. All right, so as we think about the take-home messages that we wanted to convey as we're kind of wrapping up here. So the first one is that these learning and mental health difficulties, the comorbidity of them is really common and to be expected. And that ADHD and anxiety and depression are two of the most common comorbidities that we see. For dyslexia and ADHD, we know that best practice is to treat dyslexia and ADHD simultaneously. So the wait and see approach is definitely not recommended. Instead, we want to really focus on structured literacy approaches for dyslexia and a suite of approaches, including behavioral treatments for ADHD at the same time. And the behavioral treatments, in order to know that you're in this sort of evidence-based space, you'd want the behavioral treatment to involve working with caregivers and teachers on increased structure and positive reinforcement systems as some of the best practices there.
And then as far as dyslexia and anxiety, the best practice is to treat them simultaneously. And as you noted, in some cases, early intervention might prevent later onset of anxiety. For some children, also wanting to note that, especially for both dyslexia and anxiety, but oftentimes for things like dyslexia, and why we're so thankful for organizations like LDA, that are getting those messages out there and trying to increase awareness and, build programming for screenings and things like that, so that we are picking up on these differences earlier and building in early intervention, that there's, some support for that being helpful as it relates to future anxiety. That being said, we absolutely can address with many of the things that we've been talking about, difficulties with learning and anxiety and mental health at any time that it is identified. And also just noting that behavioral treatment should involve skills-based approaches to identifying and facing fears, to addressing worry thoughts or negative and depressive thoughts, things like that. And again, that can happen within the same sphere. So.
Okay, so we hope those general take homes came through. Oh, and I think you were up to talk about these.
Oh, I am, yes. So again, here are just some more general resources that we like. So again, our host, the Learning Disabilities Association of America, Child Mind Institute, understood.org has a lot of, these are ones that have kind of some overlap in providing resources on learning and mental health. And understood.org has a lot, especially about navigating that educational process, and also kind of brings in a number of topics as also, and then the effectivechildtherapy.org site that was mentioned earlier also.
Yeah, and we do think it's important to try to provide pointers when we can to good evidence-based resources, because as you know, sort of general searches can lead to kind of myths and less evidence-based information. So we hope these are helpful. And that is it for us. We really want to thank LDA for drawing attention to such an important issue. And thank you all for coming. And we are going to take some questions.
Thank you so much for your presentation. So yeah, we're going to hop into some questions. This is a good reminder. If you have any questions, be sure to put them in the Q&A section. That way it's going to be easier for us to find them, so we can answer them more quickly. But I'll kick off the first one here. This one is from the chat. It says, can some of the methods of helping students that may have an LD be used for teaching adults or assisting adults with undiagnosed LDs?
You want to take this?
You go for it.
Yeah, that is an excellent question. And yes, we have some partnerships with some wonderful providers here, and I'm sure they are in other places as well, that do have more of a focus on working with adults. And so the same so I'm not an interventionist, so I'm going to tell you what I have learned in the conversations that we have with people that do a really excellent job with this, is that the sort of core features are there. Sometimes there's a little bit more of an emphasis on what's called morphology, which is sort of word parts and sort of understanding roots and things like that, to help with developing those literacy and spelling skills. But yeah, it's absolutely something that that can be done for adults too.
And did you address anxiety as well?
No, yeah. I might have missed that part of the question.
Yeah. So and certainly the same skills-based approaches for anxiety and depression, working on avoidance, worry thoughts, negative and depressive thoughts. All those have been shown to be effective in adults as well.
Great. So we had a couple of questions about dyscalculia, about whether you'd worked with children with dyscalculia. One of the main questions was, would you expect to find a large difference in students diagnosed with mathematics LD and or ADHD?
In terms of, I'm going to assume that's about rates of comorbidity.
Yes, and I think also in terms of solutions as well.
And solutions as well. Yeah. So you take the math. I'll take the comorbidity. Right. That the rates are very they're very comparable. So the same anxiety, depression, ADHD also being among the most common comorbidities for those with math disabilities as well. Of course, not every child with a math LD will have those comorbidities, but there are, just like in dyslexia, increased rates of those. So it's pretty comparable. The treatment for ADHD, anxiety, and depression, if in the case of math LD, would be the same, but the instructional focus to treat the math is going to be different. So you want to talk about that?
Yeah, so part of why we focus on dyslexia is because there are, at this time, there's sort of a bigger history of research and programs that have been developed and studied and things like that. We're not quite as far along with math, although this is certainly an active area of research. And I think the suggestion, you can correct me if I'm wrong here, is that the same kinds of principles are helpful as far as having structured, multisensory, systematic approaches to teaching math. You also have heard us not really using specific learning difference or specific learning disability, because it really tends not to be that specific. So you may see some children where we're noticing more of the challenges in reading, but you may see trouble with memorizing math facts is very common in people that have dyslexia, or a child that may have more difficulties in math, some in writing. You can sort of see different patterns across learning, which gets to some of it being a little bit more general. And for some kids, it can be fairly specific, but I would say it's certainly more common for us to see some degree of challenge with aspects of different subjects for the kids that we're seeing. Anything you would add there?
No.
Yeah.
I agree. We need more research in math. That's a new area for my lab. But more there would be really helpful.
Yeah, and one just resource that we tend to talk to families about when it comes to math facts is sometimes there's that just rote drilling, memorize of your math facts. Doesn't always work great for kids that might have learning differences. And so there are a couple of resources out there that take the more contextual approach to learning facts, like Math Facts the Fun Way, and Times Tales, ones that add context. So songs and stories and things like that to math facts. So that kind of approach. Mm-hmm.
Great, definitely need more research in that area for sure. So we had two questions about this, and it was about ADHD symptoms and anxiety symptoms, sometimes misdiagnosing or confusing one another. So this one was, do you see students who present with ADHD, but then once the anxiety is treated, the ADHD behaviors subside?
That's a great question.
Yes.
Mm-hmm. Do you want to speak more about that first?
Just yes. But when you're trying to make that, when you're trying to sort out the role of ADHD and anxiety, you are often relying on history and trying to understand how attention is when anxiety hasn't been as front and center. So that's just an important kind of differential gathering information point. Sometimes they've been co-occurring all along, and it can be really hard to separate those out. I know that colleagues they'll basically say, we're not quite sure. We definitely see anxiety. We're not sure if ADHD is truly there. We're going to treat the anxiety and then revisit the ADHD afterwards. I've seen as an approach. I've also seen as an approach, let's kind of work with executive skills and anxiety simultaneously in our behavioral treatment. So that's really kind of an individualized question. What would you add there?
Yeah, right. And I think as what's being mentioned around really looking at that history, times when anxiety maybe wasn't as present, and also recognizing that we see it not that the reverse isn't quite the right way to term it, but where we see sometimes, and this I would say happens for girls in particular, where it's people are putting it all on anxiety, and it is co-occurring with ADHD, and the anxiety piece is sort of helping with that presentation in the classroom of not really coming to the teacher's attention and wanting to do things well, and then making mistakes, those kind of errors that we see, forgetting to hand in assignments, some of those executive skills pieces, right? And so we're trying to attend to things that might be related to anxiety or ADHD and not kind of attributing too much to either. So I would say we see that as well.
Mm-hmm.
Sure. So this one, I was wondering if your work had maybe touched on this. Is anyone looking at PTSD in students with LD during the pandemic, or even just, the current mental health crisis within the pandemic?
Yes.
Mm-hmm.
I've seen some large scale studies happening, particularly in students with learning challenges related to the pandemic. I don't have results for you off the top of my head, and I don't know if they're out yet. I can't think of anything that I know results of yet. Do you have anything?
No, I know that there are things happening for sure, and it's an excellent and really important question. But yeah, nothing that I would feel confident saying is that's
in our department, we did have a number of investigators just look at mental health in teens during our shutdowns, and all the high rates of mental health concerns that you would imagine were documented as well. So I know that about that just sort of in the general teen population from some colleagues here at DU. But yeah, I don't feel confident giving you anything specific on what we know yet on the LD part.
Mm-hmm. And yes, this has definitely been something we are always evaluating social and emotional functioning in the kids that are coming through our clinic. And we have absolutely had just, we can look at this at some point, but sort of anecdotally, we certainly have seen an increase in mental health related challenges and kind of making recommendations to support that piece as well. It's kind of always, sort of been there for sure, which makes sense, but certainly quite a lot related to the pandemic as well.
Of course. So you had mentioned math anxiety briefly, and someone was asking if it's related to a math learning disability or if it's more of a general term without an LD diagnosis. What's sort of the connection there, if there is one?
Yeah, so this is a really interesting space where math anxiety has been studied both separately from math LDs and comorbid with math LDs. So there's math anxiety. It is possible to have math anxiety without having a math LD, and individuals with math LDs tend to have higher rates of math anxiety. So what I think is interesting is just that math anxiety is something that we study frequently and we think about, but we didn't even have a measure of reading anxiety until a few years ago. So I guess I'm trying to develop kind of a parallel research stream there to understand if you're struggling with an academic skill, anxiety related to that academic skill is a common occurrence. And so reading anxiety, I think, is a really interesting construct. Anything on that?
Yeah, no, that was great. Yeah.
Thanks for that question, though.
Definitely. Well, and you touched on some ways that this can be used for adults as well. Has your work touched on any ways that for resources for assisting with dyslexia and ADHD and anxiety in the workplace, whether it's even just transitioning into the workplace or post-secondary?
Yeah, it's a really good point. And I tend to be more on the school age end of things.
Yeah, we tend to be in our clinic as well. We will, we do see some adults because those are harder resources to find. And certainly from an identification perspective, that's something that we do. And we have some sort of community providers that work more exclusively with adults on, especially around the executive skills, kind of organizational pieces. But it also is a place that I do feel like is a little less kind of resourced and sort of how it works. We have some trouble sometimes in schools kind of getting good resources and accommodations. And I think we see that unfortunately kind of mirrored in the workspace at times as well. So,
yeah, and the place where I feel like I'm most familiar is in the high school to college transition, where student self-advocacy skills, students' understanding of their own learning, and the best ways that they get their best performance. Those sorts of questions, I feel like some universities are developing programs to help support that in their, we have a program called the Learning Effectiveness Program, for instance, here that supports students in kind of that self-knowledge and self-advocacy. So I know there's work happening around that transition in particular, and I think it's a really important one.
Absolutely. Well, we are at time, so that is all the questions we were able to get to, but I just wanted to say thank you so much for your time and for this really helpful presentation. And thank you everybody for attending as well. There will be a replay of the webinar and the presentation will be available within 48 hours. And did you want to end on any last words, any last notes?
Yeah, that's
Sorry,
a great
put you on the
question.
spot.
No, just thank you. We really, really value the opportunity to be able to talk about this. And in psychology, as we mentioned, it isn't always the sort of consideration of the interactions and the ways that learning and mental health overlap. So we just really appreciate the opportunity, and thanks for joining. I'm in a weird sun patch chair, but it's all right.
Thank you.
Thank you.
Thank you, everyone.